Well, good afternoon, everybody. Today we have another great guest. So Dr. Owen Nichols, who's the Chief Executive Officer of NorthKey Community Care. Dr. Nichols, thanks for offering some of your time today.
Judge Knochelmann, thank you for the opportunity to talk about NorthKey and the impact that COVID has had on our community and the folks that we serve. Glad to be here with you today.
You bet. So you've now been leading the organization for about 12 years, but tell us a little bit about yourself and then also what is NorthKey and what does it do?
Well, my background is as a clinical psychologist, and I had worked in mental health for about 20 years before coming to NorthKey. Had known about NorthKey, had known both of the prior executive directors of the organization. And when the opportunity came up to move to Northern Kentucky and become a part of a great organization, I was very excited to do that. A lot of people don't realize this, but NorthKey is the oldest continuously operating community mental health center in the country that was created under the Federal Community Mental Health Center Act. That was the last piece of legislation that President Kennedy signed into law. And Kentucky was the first state to implement that, and NorthKey was the early in starting and is now the longest continuously operating community mental health center. And, you know, in terms of what we do, we provide services for individuals with mental health, substance abuse, and developmental disability services across the entire age spectrum.
And you go from children all the way up to seniors. And every single one of those categories is being dramatically affected by COVID. And you've got a legacy at NorthKey that is really unprecedented, as you point out. But fill us in. What does it look like now in dealing with the pandemic and the effects on mental health?
Well, when the pandemic first came about, we immediately switched over to doing primarily telehealth services. So we went to about 80% of our services being offered by telehealth within about a week to 10 days in the beginning of the pandemic. And then over the summer, we shifted back to about 50% in person and 50% by telehealth. And right now we're running about 30 to 40% of our visits are in person. We've got a lot of folks that are dealing with serious mental health problems and serious substance use problems. And they prefer the in-person visits. They need the additional time and attention of an in-person visit. So there's, you know, we even provided tablets and internet connectivity to a lot of folks in order to get services to them, but a lot of folks just weren't able to participate in that.
So a typical client today who is seeing you and the impacts of the pandemic, we hear about isolation, we hear about some of those things, as well as the fact of disconnecting from students who you may have otherwise been able to get access to the school. So maybe speak to some of those populations that you're seeing this change of service.
Well, we immediately saw an increase in anxiety, depression, and insomnia. I think one of the most staggering bits of data that I ran across related to that was within the first 6 weeks of the pandemic, the pharmaceutical industry reported that they had a 75% increase in new prescriptions for people for antidepressants, anti-anxiety medications, and insomnia medications, not refills, new prescriptions, a 75% increase within 6 weeks. Now, likewise, it was also reported that there was a 300% increase in the sale of alcohol within that same time period. So, you know, we are dealing with all of those issues with the people that we are providing services for. I think one of the things that concerned me most about the pandemic is how the lockdown was handled, because there was really no effort made to inoculate people from the stress that they were going to experience from the lockdown. Because being told that you can't go places, you can't do things creates a significant amount of stress. And people lose the community supports that they have available to them. They lose their ability to attend church. to participate in school, to participate in social clubs and community events. And all of those things are ways of people helping to stay connected and feeling supported in their community. And it's a little like, I describe it, it's a little like going to the dentist. When you go to the dentist, you know you're going to get a shot if you have any dental work done, but he tells you ahead of time, this is what's going to feel like. You're going to feel a pinch and a sting. And yes, it's going to hurt a little. So you're prepared for it when it happens. We didn't do any of that inoculation to the stress. We've learned from combat and natural disasters, if you prepare the public for the stress that they are going to experience, if you prepare someone going into a battle for the stress that they're going to experience, there's going to be far fewer fallouts from a psychological perspective. So that is one thing that really concerned me, because I think that a lot of the things that we're seeing in the public right now is as a result of people were overwhelmed with the anxiety and concerns that were brought about by how it was managed. And we're, slowly working our way through that.
Well, and you think about it, I guess, and correct me if I'm wrong, but even for those who are still employed, those who have resources, the stresses are still there. And you think about those who aren't employed or have had windows of period where their businesses have been locked down or they haven't been able to work. It's just exponential of the issues you're talking about.
Exactly. And, I'm hearing some of that from business leaders because, we've had some people that they have basically had their employees operating from home completely. And now when they're trying to get people to come back into the office, to come back to work and so forth, the folks have tremendous anxiety about going back into the office setting. And are resisting that. And even people, their productivity is beginning to drop off as a result of this going on for such a long period of time. And I think of it as a species, we're very resilient, but as individuals, we all have our limits. So, when we have a natural disaster, whether it is a tornado or a flood, we know that's going to last for a period of time, and then we're going to come out on the other side of that. This has gone on so long that people that normally would not have experienced the level of trauma and stress in their lives because they're very resilient people are now experiencing many of those things.
Again, well said.
And another concerning thing is we're now seeing clear data that about 30% of the people that have had COVID that recover physically are now having mental health problems that they didn't have before having experienced the disease, which makes us think that there's a real significant biological component to some of these issues. And likewise, we're seeing the same thing with cognitive issues among these folks. They're reporting feeling like they're in a fog, feeling more confused at times, feeling like they're having trouble concentrating and thinking. And it reminds me a little bit of concussions. We knew for years that if you had a concussion, you were going to probably have some dizziness and you might have a headache and you might have a little trouble with your sleep being out of sorts. But it wasn't probably until the last decade that we figured out that those cumulative concussions doubles your risk of suicide and increases your risk of early onset dementia. So I'm very worried about what we're going to see with long-term COVID patients because of that.
So doctor, as we get through the rest of this pandemic timeframe, what kind of recommendations would you make to help keep everyone healthy?
Well, I would strongly recommend that everybody follow the same routine and structure as closely as they can to what would normal before the pandemic. I give myself as an example. I come into the office every day, even though most of our employees are working from home lots of days, because that's part of my structure and my routine. And that structure and routine helps to keep me mentally healthy, mentally fit. And we know from good data, if you do any activity for 4 to 6 weeks, it becomes a habit. And unfortunately, the pandemic has led to people developing lots of bad habits. They are, maybe not getting up as early or as they would normally. They're sleeping in, which disrupts their sleep in the evening. They may be drinking more because they're at home, which creates the risk of a substance abuse problem. They may not be exercising or getting dressed like they normally do because they're, working in a situation at home where nobody's looking at that and observing them. So I always encourage everybody to set a routine and stick to it as closely as you can for your own mental health. Well
said. Well, and as much as this news is kind of unsettling, we have resources in the community to help, and you've got a number there in your background that shows that if people need assistance, and of course you would encourage them to call their physician. If they don't have a physician to call first, they can feel comfortable calling your organization, and if you can't serve them, you'll direct them elsewhere, I believe, as well, correct?
Absolutely. We're available 24/7. If you have a mental health or substance abuse or developmental disability crisis, you can call that same number that's on the screen to make a routine appointment. And we will help you get the services that you need, whether it's for yourself or for a family member. We have that number is similar to a suicide hotline as well, because if we have people that are experiencing thoughts of wanting to harm themselves, we want to get immediate care to them. We're willing to come out and see you wherever you're at. And we will get you the service that's needed, whether we provide it or whether we refer you someplace out in the community.
And I think you've said this before to the community. There's no shame in needing assistance. That's what you're here for, and you want to make that available to everyone who needs it.
Absolutely, there should be no stigma whatsoever attached to needing a helping hand. I tell people, by the grace of God and a community mental health center, I'm here today because I grew up in those circumstances as a child where we got services at a community mental health center, and it turned our lives around. So we need to make sure that everybody has that opportunity when they need it.
Well, Doctor, thank you for your time today. Thanks for the update, and wishing you the best in these challenging times. And I know the work ahead of you is huge, but I know you're all, and you and your team are up for the task. So thank you so much for your time.
Thank you so much. Appreciate it. And glad that we're getting the information out to the community.